Jolene says, is there a role for steroids, hyaluronic acid and PRP injections?
Thank you. Who's that, Jolene?
Jolene, yep.
Thank you so much for giving me an opportunity to answer that one. Right. The most injections in the knee are utterly pointless. All right. At best, they do nothing, and at worst, they cause more damage. If you look at the proper studies, PRP, platelet-rich plasma, injected into a knee joint, utterly pointless. Hyaluronic acid injected into a knee joint, utterly pointless. The American Academy of Orthopaedic Surgeons have removed these from their treatment algorithms for arthritic knees, so pointless. No evidence to do them whatsoever for things like meniscal tears. The best thing you can inject into a knee is also the worst thing, which is steroid. The reason it's the best thing is it's quick, it's cheap, it's very, very low risk. It acts as a powerful anti-inflammatory, so it will mask your symptoms. The reason it's the worst is that it will mask your symptoms. And if you mask the symptoms, you're fooling somebody into thinking their knee's better when it's not, which encourages them to do more. So by the time the injection's worn off, the damage and the symptoms are worse than they were beforehand. Very good study published a couple of years ago showed that for every steroid injection you give into a knee joint, you increase the likelihood of that patient ending up with a knee replacement by 10% per injection. So if you've got a reason to inject somebody's knee with steroid because you want, let's say they want to go on a round the world trip or they want to walk their daughter down the aisle in a month's time, well, as long as you discuss the pros and cons, so the patient has fully informed consent and they understand the negatives, well, then there's an argument for going ahead. But would I ever inject steroid for a meniscal tear? No, I think it's utterly stupid. It shows a complete lack of understanding of the pathology, the physiology. I think it's a daft thing to do.